Hello and welcome to the Caring Matters podcast. I'm Liz Tassone and I'm here today with Anne Frederickson. Anne is the project manager of the Ohio Senior Medicare Patrol. And she's going to talk to us today about what she does for the Ohio Senior Medicare Patrol. She's located here at ProSenior, so we're hoping she'll talk a little bit about what ProSeniors does as well. But first, tell us about the Ohio Senior Medicare Patrol.
Thanks, Liz. I appreciate the opportunity to talk to you all and the caregivers today. The Senior Medicare Patrol Project is a federally funded program. There's one of these projects in every state across the country. And the thing that we are charged with trying to educate beneficiaries and caregivers about the enormous problem of Medicare fraud, waste, and abuse. And it's a huge problem. About $60 billion a year is wasted in Medicare fraud, waste, and abuse. Sometimes it's even errors, but I tell folks we need to get that corrected because if it's a mistake, say someone had a billing issue or something that was billed on their behalf using their Medicare number, it still needs to get corrected because Medicare keeps a composite of people's health claims. And say, for example, you had a broken hip and someone used your Medicare information and you ended up needing to get a broken hip replaced or fixed, and somebody else had already done that, you may be denied that procedure.
Okay.
And so I'm not trying to say that to scare people, but I just really want to impress on people how important it is to review your Medicare summary notices on a regular basis. Make sure that that identity information is protected and keeps secure, just like you would your Social Security information as well.
Okay, so an older adult or their caregiver, when they get those in the mail following as a follow-up to a doctor's visit,
right,
saying what's been paid and so on, that's something to take a look at and not just throw in the bin here, huh?
Exactly, right. We really encourage folks to look at that Medicare summary notice that comes out quarterly. It used to be monthly.
Oh, okay.
Now it's quarterly. So I don't know about you, but I can't remember what happened yesterday. So if you had gone to a doctor, say 30 days ago, you might not remember exactly what you had done at that physician's office. So we also offer a personal health care journal that we pass out, and we have that at our office, and we're happy to give those away. We will be giving those away at the Medicare Fraud Forum that we're going to talk about later. And that is like what we call our Bible, so people can record their information and then compare that to their Medicare summary notice. Or even if you don't have that, if you have some way to record or document when you have procedures or visits or any kind of health-related information to put in that particular piece of
So even a notebook would work.
Absolutely.
As long as you're keeping something in one place, so you get home from the doctor and you write down everything he did, everything he said, and so that when your bill comes, or not the bill necessarily, but you're saying the Medicare statement comes quarterly,
right,
that you compare the two.
Right.
And you might identify fraud that's going to save our country billions of dollars.
Right. And the good thing is those Medicare summary notices actually explain, and they're going to be better, by the way. They're rolling out in 2013 new Medicare summary notices, which is great. There's going to be more prevalence of messages about Medicare fraud, how to report it. There's also going to be clear definitions of understanding what procedures are and what codes are, because in the past I know it's been very difficult for people to understand the medical jargon that's associated with all that. But this, the Center for Medicare and Medicaid Services, CMS, has come out with all new summary notices, and I think people will be very pleased with how legible and understandable they will be.
Great, much more user-friendly for all of us.
Good word for it. Yes.
Great. Now, before we went on the air today, you said you just got a notice from the federal board that regulates Medicare that there's some fraud that we want to make aware of the people that would be listening to this podcast. So tell us about that.
Yes, thank you for asking about that. The Administration on Aging, or it's also now called the Administration of Community Living, they have a new name, has actually taken it upon themselves to ask all of us senior Medicare patrols across the country to give them information about a big scam that's going on around the entire country, and that's where a lot of telemarketers are calling seniors, beneficiaries, particularly those that are in home that are maybe no longer able to get out, and they are very vulnerable and at risk, and they call them and ask them for their Medicare number. And unfortunately, some of the folks have taken victim to this, and then they have used their Medicare number to bill for Medicare services, and or they've also, if you probably know, Medicare numbers are also your Social Security numbers most of the time. So then they've also created identity theft. So they've asked us to provide that information to the Center for Medicare and Medicaid Services, and they're going to be putting out alerts to tell seniors, their caregivers, to protect them. And we have a saying in our office that it's shrewd to be rude. We tell people to hang up when telemarketers and people call them and ask them for information, particular personal identity information, not to give any of that away.
Wow. So there's no time that a Medicare representative would call them and ask for that information.
That's an excellent point, Liz. No, Medicare will never call you, okay? Because Medicare already has your information, okay? So they will not initiate a call. You are the only person that should be initiating a call to have any kind of correspondence with a Medicare representative. Same with Social Security. Social Security also will never call you and say, I'm with the Social Security office, I need to talk to you about an issue with your Social Security benefits. They also will not call you. And I will even make further clear that sometimes organizations, bad, unscrupulous people, can actually do what's called phishing, where they put the Social Security telephone number on their phone so that when the phone rings, it says 1-800-SOCIAL SECURITY or Social Security Administration, and it's not Social Security. It's because
they're
they
getting
are
sophisticated with their fraud.
Very much so, Liz. It's very frightening. They do the same thing with Medicare, 1-800-MEDICARE, and it's just a very evil person that's trying to take advantage of a senior.
Okay, so the important thing for our caregivers and listeners today is that you can be tricked by caller ID. So even if caller ID says Social Security or Medicare, do not be fooled, because they will never call you.
Right.
So if you initiate a call to the 800 number, that's a different thing.
Absolutely, Liz. That's so true. If you do that, that's fine. But don't take on these calls. And really, unless you know who the caller is, and I know not everybody has caller ID, but I would not, if I was living at home, and especially by myself, I would not answer the phone unless you expect a call or you know somebody that's supposed to be calling you.
Very good idea, because it might be, a lot of times my phone only rings for sales calls these days.
That's right. And speaking of that, the do not call list, we also have information we can share with people to tell them that you can register on the do not call to not have, all these telemarketers call you. Now, there are some exceptions. We all know that some of that gets through. They are tightening up. The Federal Trade Commission is really coming down hard in 2013 on telemarketers. So I hope that folks will see a change in those robocalls that are coming to their home.
Very good. Very good. Okay, thank you so much for that. I think that's good information that folks need to have, especially that these folks will never call you and ask that. So if someone's calling and if they're asking ever for your Social Security number or your Medicare number, hang up the phone.
Right.
It's not legitimate.
Yes, please.
Okay.
Please do.
Very good. Well, we're going to talk on a follow-up about a forum that's coming up. But for now, we're going to leave you with this great information about Medicare fraud, and for you to be alert and to also let your friends know about this. It's important information that you never give that information out over the telephone.
Right.
So I want to thank our sponsors to this program. It's Vitas Hospice, Hillebrand Home Care, Home Care by Blackstone, Family Bridges Home Care, Lifespan, and Bailey. So again, I want to thank Anne Frederickson for her good information today for us to all stay alert.
Thank you.
And always remember that caring matters.